Okay. Hi, my name is Radha. I'll be your OT today. What is your name?
Cam.
Nice to meet you. Alright, so the doctor told me that you're having some pain in your wrist and your fingers?
Yeah.
Which fingers exactly?
Some of them, like
Is it the first and the thumb?
yeah, right here and this one.
Okay. So what we're going to do, we're going to start with a phalanx test. Basically what it does is it mimics, so I think you have carpal tunnel syndrome. So basically what this test is going to do, it's going to mimic your median nerve being compressed. And that's exactly what happens in carpal tunnel syndrome. Because of repetitive movement, your median nerve is compressed too often. And that's what's causing the pain in your wrist and your index finger and your thumb. So I'm going to need you to put your two back of your hands together like this and press together for about 30 seconds. Keep it there. Do you feel pain?
Yeah.
Okay. Is it your wrist?
Yeah, right here, wrist.
Okay. All right. You can put that down. And then the second test I'm going to perform is the 2-point discrimination test. So can I get your affected hand? Actually, let me get your unaffected hand first. Okay. So I'm going to touch the tip of your fingers with either 1 point or 2 points, and you're going to tell me which one it is, all right? So we'll start out with, this is the unaffected hand. Can you look away, please? All right, so just let me know if it's 1 or 2.
1.
Okay.
1.
Okay.
1.
Sorry. All right.
1. 2.
Okay. So that's correct. Can I get the affected hand now? Okay, and look away.
2. 1. 1. 2.
Okay.
1. 1. 1. 2.
Okay, and last one.
1.
All right. So what that shows is where the numbness is happening, because that's one of the symptoms you're having. Okay, so now we're just going to go over some of your workspace area and kind of see if there's anything we could change here because of your wrist pain. Okay, so can you try typing for me right now? Okay, so here, the keyboard is actually a little bit higher than your wrist, and your wrist needs to be in a neutral position. So for that, I can actually recommend an easy fix. You could just put this pillow right here so that it's actually in level.
Oh.
Yeah, so that makes it easier and it puts less strain on your wrist. Also, I see you have a mouse there. You don't have any type of keypad on it, correct?
Correct.
All right, so we can actually take like any type of t-shirt or anything, roll it up, put it here so that you're not, bending your wrist too much either for that. All right, and another thing I see is this is a manager's chair. Can you please lean back, or however you sit usually?
Yeah, this is how I sit.
Okay, so you see how your back is not in the correct posture position. So what you can do instead is you're going to have your hips at a 90-degree angle. Put your feet down, flat on the floor, both of them. And you're going to move up a little bit so you're not completely leaning back. And kind of sit up straight so your hips are touching all the way to the back of the chair.
Okay.
Do you see how that feels?
Yeah.
So the chair is kind of leaning backwards, so it's not going to be supporting you. The type of chair you actually need is something a little bit more straight up. These chairs are not good for posture. Okay, so I'm just going to check out a couple other things around your workspace area. So I see that a couple of your files are out of reach. How do you usually, get them? You have to go and reach for it every time?
Yeah, kind of.
Okay, and I see you have a nice filing system here. Do you use that ever, or?
Yeah.
Okay, that's actually a better idea than putting your papers way at the edge of your desk. This usually helps kind of take that strain out of your back, and you see how you're constantly reaching over.
Right.
So I would suggest using this bookshelf right next to you more often. All right. Another thing, the lighting. It's pretty good right now, but during the day, do you have this light on?
When it's cloudy.
Okay. And what do? You usually have these blinds open?
Blind open, yeah.
Okay, that's good.
Daylight.
All right, good. You don't have a desk lamp, do you?
No.
Okay. Sometimes if you're reading something, a desk lamp would be great, you know?
Yeah.
Get the proper lighting you need.
Mm-hmm.
All right, and let's see, we talked about your keyboard, your mouse, the posture. Okay, so I'm gonna actually show you some exercises to do at home for your carpal tunnel syndrome.
Okay.
This will just help work out the hand so that it's not in the same position. Try to do these at least 1 to 2 times a day. Once in the morning, once before you sleep maybe, or whenever you have time you're sitting here at your desk. So we're gonna do first this, then down, fist, straight out like this, 90 degrees, so it's gonna be like, yep, and then back here. So I'll do it again, up, curled, fist, flat, down. And do you think you'll remember this, or I can write this down for you?
Okay.
Okay, let's do it one more time. So up, curled, fist, straight, down. All right. I'm going to ask you about that in the next session, so try to remember those. What were some of the suggestions for your keyboard that I made? Do you remember?
Yeah, supporting and getting it right height.
Okay, and try to use this at least for 75% of the time when you're on your computer.
Mm-hmm.
It'll help with the wrist straining. We want to try to keep the wrist at a neutral position at all times.
Okay.
Okay, and yeah, that concludes our and the mouse. You're gonna try to put any type of leveling. You could even put like a cotton pad in there if you need.
Okay.
Or get that kind of mouse pad that has the bump in it.
Mm-hmm.
That'll help.
Okay.
All right, and that concludes our session for today.